Hey you all, I am Dr. Meenakshi and this video is going to help the MRCOG Part 2 students. This is going to be a quick revision regarding the Cervical Cerclage Green Top Guideline 2022. The Cervical Cerclage is recommended for women with single-term pregnancies and not for multiple pregnancies. And we have got two different entities. One is the history indicated cerclage and the second one is the ultrasound indicated cerclage. In history indicated cerclage, in women who are having a single-term pregnancy and a previous history of 3 or more previous preterm births or mid-trimester losses, they would fall under this category, wherein we do the cerclage at 11 to 14 weeks of gestation. And the second category is the ultrasound indicated cerclage. In women with single-term pregnancy who have had 1 or more previous preterm birth or mid-trimester loss, wherein they are not performed the history indicated cerclage, if they don't fit into that category, then we do the serial cervical length surveillance, which is between 14 to 24 weeks of gestation. And if the cervical length is less than 25 mm, in those cases we do a cerclage. There is also another entity which is called as an emergency cerclage. This emergency cerclage can be performed up to 27 plus 6 weeks of gestation, wherein a woman has some complaints, and when you do a speculum examination, when you see that the cervix is dilated and if you see that there are some bulging membranes, in such cases we perform the emergency cerclage. In the ultrasound indicated cerclage, we have again got two categories. One is the women with high risk and in the other is the women with intermediate risk. In women with high risk, like for example, if a woman has had a previous preterm birth in less than 34 weeks or any mid-trimester loss, or in women with previous history of PPROM, which is preterm premature rupture of membranes, or if they have had any kind of known uterine variant, in any kind of intrauterine adhesions, or if they were performed a procedure which is called as trachelectomy, or in a previous history of cerclage. All these women will fall under the high risk category, wherein they will be seen by a preterm prevention specialist as early as 12 weeks of gestation. And in them, we perform the serial cervical length measurement between 16 to 24 weeks. And if the cervical length is less than 25 mm, we do the cerclage. Whereas we have got another category, which is the women with intermediate risk, wherein there are just two categories. One is in the women where the cesarean section was performed previously at full dilatation of cervix, and in another set of women wherein the procedure called as LEADS, that is large loop excision of transformation zone, has been performed, where the depth of excision is more than 10 mm, or if the procedure of LETS has been performed twice, or if a cone biopsy was performed, they fall under the intermediate risk, and in them at least one minimum scan should be performed at 18 to 22 weeks to measure the cervical length. Well, that is a very quick revision regarding the cervical cerclage, guys. I hope you found the video useful. Please subscribe to my channel. I will see you all in another one. Bye.